Now back to this very disturbing story. At least 30 initiates have died and over 8 are in hospital in the Eastern Cape. For more on this, we're joined by Zolani Mkiva from the Congress of Traditional Leaders of South Africa. Mr. Mkiva, thank you very much for your time this afternoon. Now, the increase in deaths is very concerning to all of us. And you as Controlesa maintain that something drastic needs to be done to curb this increase. What do you exactly propose?
Well, indeed, we are very much concerned with this disaster of more than 27 boys having passed as a result of going through the rites of passage from boyhood to manhood. We think that the only solution now is for the formalization and the institutionalization of the traditional schools, the traditional initiation schools, so that we can then have a focused attention wherein we can even have budgets and the deployment of other resources, including human resources with expertise from the health sector, as well as from the side of police and so on, so that we can have people working full-time into the season, so that we don't have an ad hoc basis. Unless we do that, by capacitating the institution of traditional leadership, so that every time when there's going to be the initiation season, we make a declaration, there's a clear process of registration of all the initiates that are going to go through initiation in that particular season ahead of time. There must be a proper plan so that monitoring is not just an ad hoc monitoring, but there are full-time people who are designated to work there, including medical practitioners who have gone through the exercise of initiation themselves, so that the whole management is professionalized.
No, just listening to you, it sounds like something that could be done. But if you had to be granular about it, practically, are you saying you have a health official at each and every registered initiation school, and then you also have a police officer that is deployed there? How would that work? Because I can already foresee the health ministry saying they do not have that capacity.
There is no way that the government can say they cannot have such a capacity. It's a must. It's something that that has to be done, because this exercise is an ongoing exercise year on year, and hundreds of thousands of boys go through initiation every year. We need to be ahead of time and ensure that we plan for this formalization and institutionalization of the initiation seasons, so that they are part and parcel of the national plan. If we don't plan, then the consequences are always going to be disastrous.
Most certainly there needs to be something that is different that is done this time around. But wouldn't you propose the opposite, where instead of having health officials actually being deployed to the registered initiation schools, perhaps you could have personnel from the initiation school going to get adequate training from the health officials? Because I don't think, or at least you haven't mentioned, that there's any capacity issues in the initiation schools themselves. They have possibly the human resources that they could then send to get the training. Would that not work better if they were sent?
We have to combine both things. We have spoken about the capacitation of the institution of traditional leadership, including capacity training of the traditional nurses as well as the traditional surgeons. It can't just be a one-way, because they would not have the complete picture. Remember, we live at different times, we eat a different kind of food, and therefore we can't always act as if we are in the 20th century or the 19th century. So it's very important that we acknowledge the fact that culture moves with time, and the manner in which people are built in nowadays is different because of the different type of food that they are eating. And therefore, it is important that we combine both organic approach to issues as well as the medical approach to issues, so that we prevent death at all costs. So I agree, and in fact, it is our statement that we must work with the traditional nurses and traditional surgeons and ensure that we capacitate them. But at the same time, we must bring in health practitioners who have gone through the exercise so that that training is a process rather than an event. Because the capacitation of traditional nurses and traditional surgeons, it can be made an event. It must be an ongoing exercise. So
Oh, unfortunately, we've lost Mr. Mkiva there. Very important conversation there, at least him saying that there needs to be some sort of capacitation of these schools, and perhaps where we can either see health officials being brought to the initiation schools, or even have a situation where we have some of those officials within the initiation schools actually been taken for training, and it's something that is not an event, but something that is progressive, or something that takes over a period of time. But hopefully we can re-establish that line to just finalize some of the statistics as to whether some of these deaths were in fact at registered or unregistered initiation schools. Hopefully we can, but a reminder of your top story.